Hello, hello. Hello, everyone. I'm Dr. Venga, your board certified osteopathic OBGYN, here with you on another Saturday morning at 11:30. So we're back to our usual time this week. If you recall, those of you who've been following, last week I went a little earlier because it was a holiday weekend here. I am coming to you from Greensboro, North Carolina in the United States. So a lot of my references are based on my location. However, I do try to make some things relevant since I know a lot of you follow me from all over the world, and I really appreciate that. So I try to make this as relevant as possible to you. I see we already have some people watching, so hello, hello. Thank you for being here. This will be my fourth actual live. I did an intro video originally just to introduce myself and my goals and my ideals and my mission through this forum. And then I believe I explained then that I would be alternating the weekly lives where I would be doing an obstetric topic one week and then a gynecologic topic another week. I've appreciated all your questions either during the lives or after the lives because it gives me a lot of ideas as to what to do the following week. So really almost all my topics so far have been based off of your questions and feedback, and this week will be one of those as well, so thank you for that. The first one I did, I believe, was on fibroids. We talked about that, and then we talked about pregnancy in the mature years. Last week was the dreaded menopause, and again, your feedback has been really encouraging. So this week, this topic, like I said, is based off of a question that one of you posed, and we're talking about alternate ways of having a child when traditional methods have failed. So for those of you who are joining me for the first time, I'll introduce myself again. I am Dr. Venga, your board certified osteopathic OBGYN. I am here just to impart some knowledge and to demystify some of the myths that we have about our female bodies. And I know I have some men joining me too, so about the females in your lives bodies, just so that you can feel more empowered to make healthcare decisions about yourselves, about your daughters, about other women in your lives. And through that, I feel like we'll be able to find our voice and make the decisions that we need to make. So that's my mission through these. Okay, so pregnancy as we know it through the traditional way is a man deposits semen, contains sperm, in the vagina, and the sperm travels up the cervix into the uterus, into the fallopian tubes, where it meets the egg. I made a little crude diagram. I'm not going to use the pictorial that I had last time because I had some feedback from the camera, and I haven't quite figured out how to get that off. So I'm still working on that. So I hope this works better. And I'm not the best artist, so bear with me. Okay, so let's see. Oh, I don't know that this is gonna work any better. All right, I'll just go back to my old pictorial. So here. This is my favorite picture ever. So sperm goes up the cervix into the uterus, goes into the fallopian tubes. The ovary releases an egg. The egg meets the sperm in the fallopian tube. They meet, form a zygote. They travel into the uterus and implant. Okay, I'm going to work on these pictures and try and see if I can get better images to you. So once that's the traditional way of having a child. Unfortunately, for some of us, we're not able to have a child that way if we want a child. We have to remember not everybody wants a child. So please keep that in mind as well when you are talking to people, when you are asking about people's relationships and lives and whatnot, because there's a lot of stress and a lot of insecurity that you can you can bring up in people who don't want to and who don't want to address that. So always be sensitive about those topics. Okay, so for those that do want to, if this traditional method does not work for you, and that could be for several different reasons. I like to always start out with the non-obvious reason. It could be because of the sperm. It's not always because of the woman's body. So it could be because there's not enough sperm. The sperm doesn't move fast enough. The sperm can't make it through the cervical mucus. There's an amount of mucus around the cervix, and sometimes the sperm can't make it through that. Sometimes the shape of the sperm is faulty. And this could be either because of genetic reasons or lifestyle reasons, or it could be because of some genetic disease that the male has. So depending on what the issue is, there are vitamins that men can take. And usually you can either see a urologist or an infertility specialist. So when you think infertility specialists, you think they're only for women, but there are some infertility specialists that can also prescribe vitamin regimens for males to be able to improve their sperm count. So that could be one reason why traditional methods have failed, because there's a male factor there, and I believe the percentage is somewhere around 15% of the time it's a male factor. Then we come to the woman. So it could be because of the eggs. As in previous lectures, we've talked about egg quality based on age, based on health status, based on several different things. So it could be an egg factor. Now, sometimes a woman is just not ovulating regularly, so that's one area to look at. And sometimes the eggs are not of good quality, so then you have to look at other methods there. And again, this could also be because of several different factors. Then it could be because of the uterus. The uterus itself could have a structure that is not encouraging for a fetus an embryo to implant. There could be fibroids, there could be scar tissue. If the fallopian tube has any kind of infection or anything that could have blocked the tubes, and sometimes we don't have a reason why, but that could be a factor. So that's an area that could be explored to see if we could fix that to help the traditional method. And then it could be the cervix. Like I said, there's the cervical mucus that the sperm has to make it through, so that's one factor. But there are some people who are able to get pregnant, they're just not able to stay pregnant because they have early pregnancy losses, they have miscarriages, and there's several different reasons for that, and that might be another topic. But one factor could be that the tissue of the cervix, the connective tissue, could be weak, and sometimes you can boost that with some hormones, progesterone. Sometimes you need to put a stitch around it, and you can put a stitch around the outer part of the cervix, which is the part that's closest to the vagina, or you can put a stitch around the part that's closest to the uterus. And again, topic for another day. But these are some structural and just very basic things that we can do to enhance the traditional methods. So what if those methods don't work for you? Then we have to explore other options, and we're lucky that we have other options to look at. So if there's any underlying health issues, diabetes, thyroid disease, blood clotting diseases, because sometimes you have blood clots that block the vessels that are helping the placenta form and the fetus form. So if there are those things, sometimes simple medication or lifestyle changes can enhance this. Hi everyone. So we talked about maybe vitamins for the man to help the semen, and also maybe for the woman, if it's an egg issue, sometimes we just need to improve how regularly you're ovulating, or the quality of the eggs. Not really the quality, but more of how you're ovulating. And there are medications that we can typically use. And I'm sure most of you have heard of Clomid. There's also another medication called Femara. For people who have a medical condition called polycystic ovarian syndrome, ovarian disease, Femara sometimes works much better than Clomid. So it's really up to you to talk to your OBGYN so that you can determine the root cause of why you're not able to have a child through the traditional methods. And you might be a candidate for Femara rather than Clomid. So these are called ovulation induction medications. So there's that. Then we get to more technological ways of helping you to have a child. Sometimes, as in the case of the person that brought up the topic, actually I'll go a couple of steps before I get that. Sometimes all we need to bypass that cervical mucus to deposit the semen into the uterus is to inseminate. That means you inject it in there, basically. And this is something some people have successfully done at home. I always recommend doing all these procedures in a safe setting. So ideally with a discussion with your OBGYN and with a full understanding of all the risks and everything that go along with it, or an explanation of how you should safely do it. But some people will do this. This is what, typically is referred to as the turkey baster method, where they just suck up some of the semen and inject it in there. And that could be either because of the cervical mucus, or because it's a couple that does not have a male involved in their relationship. So they get the semen from someone else and they do it that way. Or it could be a woman who wants to have a child by herself. She is single, she's not in a relationship, but she's always wanted to be a mother, and she is in a position where she's able to do this by herself. She might choose to get some semen either from a friend or through a sperm bank and get inseminated to have a child of her own. I would always encourage somebody who was looking at this option to make sure that whichever way you go about getting your semen, that you know the full health status of the person you're getting the semen from. Because you're going to have this child with genetic material from the sperm as well. So you need to know what the history, the medical history behind that semen, that sperm. And I'm not trying to be very clinical about this, but sometimes that's just how it is. Okay, so we've got artificial insemination. This can be done in a physician's office through more technical means, or it can be done at home. Then we start getting to things like in vitro fertilization. With in vitro fertilization, you are using the assistance of a specialized OBGYN. So this is a doctor that has finished OBGYN training and gone on to further specialize in fertility management. So they're usually called reproductive endocrinologists. So you go to see a reproductive endocrinologist, and they would first of all diagnose what the issue behind you not being able to have a child through traditional means is. And if they determine that you're a candidate for this, either because eggs don't work, fallopian tubes don't work for one reason or the other, then they will sometimes have to boost you up by giving you medications, either by mouth, so orally, or by injections to help you ovulate. They can extract the eggs, so use a needle and extract the eggs. It's very timed, it's very precise. It needs to be very clinical. It needs to not be in a setting where infections can happen, because this is all very sensitive stuff. So make sure that you're going to somebody that's well trained for this. So they extract the eggs and they take the semen, and in a laboratory setting, they put the two together. So they mimic what's supposed to happen in your fallopian tubes, but basically in a petri dish. And they put the two together, and then they can put that back inside of you because your uterus probably works. Now, sometimes they can do this and not put it back inside of you because maybe your uterus doesn't work, or you don't have a uterus. You've had to have surgery for some reason or the other to remove your uterus. or, for one reason or the other. Sometimes you can use something called a surrogate, where they put it in somebody else to carry the baby for you. And I'll explain a little bit more about that later. But let's just go with assuming that, we're doing this in the same person that wants to be the mother. So they can put this in you. They do typically follow you weekly and very closely to make sure that everything is developing appropriately. And usually once you get to about 9 weeks of pregnancy, they will graduate you back to your regular old OBGYN, someone like me, to manage you for the rest of the pregnancies. These have very successful outcomes. I can't state to you the statistics behind how successful these are, because there are national averages, there are regional averages, there are international averages, and each particular clinic and office has its success rates. So for those that are interested in looking at this route, one of the things that I encourage you to ask when you first meet with that reproductive endocrinologist is, what are your success rates for you specifically with your office, with your lab? And everybody should know theirs. It's usually a bragging right when they have quite successful outcomes. So now through this method, you too tend to exercise some control over how many eggs are extracted, how many are put back. So that is where some people tend to be a little either comfortable or uncomfortable with this method. Most reproductive endocrinologists in the national organization will encourage against multiples, because as cute as twins and triplets and quadruplets, quintuplets are, those tend to be higher risk pregnancies. And especially if you're doing this route, you're usually always a little more high risk anyway. So we don't encourage increasing the risk further. So I know there's a lot of people that entertain the thought of having multiples through that. And, twins are less high risk than triplets. Triplets are less high risk than quadruplets or quintuplets. But they're all more high risk than having a single baby. So we've got IVF, where, they take the egg and the sperm and they put them together and put them back inside of you. So I hinted about surrogacy. So surrogacy refers to where the person that wants to be the mother is not the one that carries the pregnancy. So for one reason or the other, maybe the uterus doesn't work, the eggs don't work, all of that. There's a blood clotting disorder. You've had, there's no uterus. You may need assistance from somebody else to carry the baby for you. It's a very touchy subject. Some people are lucky to have family members who will just openly offer and say, if you want to have a child, I will carry the child for you. And that's always great, because it's a family member, somebody you know, somebody you trust, somebody you're comfortable with. Sometimes you're not so lucky, and or sometimes you are so lucky, and you may have to go through an agency that offers surrogacy. So there are agencies that actually recruit women who should willingly, not unwillingly, so you want to know the history behind that facility as well, recruit women who want to carry children for other people. I know a few women who've done this. Most of those women enjoy being pregnant, but don't necessarily want to have the child of their own, either because their family is complete, but they want to help another family out. So these are the kinds of women that generally will register themselves with a facility like this to be a surrogate. Most of those agencies will have you, the mother and parent couple, or just parent, cover all the medical costs that will be associated with that pregnancy, all the way from getting pregnant, so if there are medications needed, to the postpartum era as well. There are legal ramifications for this, obviously. Sometimes I've heard of stories where you have to actually sign paperwork to say that you are the birth parents, because if not, after the child is born, you may have to adopt the child. That's your own child. And you really need to research where you want to have this done, what the laws are in that area, and both before and after, for you and for the surrogate as well. So make sure that you have your homework done with this regard, because it varies as well. And the most painful thing would be to go through this whole process, and at the end of it, you can't have your child, or you have to go through a whole bunch of legal stuff to be able to actually have your child. But surrogacy is a very fulfilling route for a lot of people, where they can have the egg from the woman who wants to be the mother, sperm from the father, put together and put in somebody else to just carry it. So in that case, that surrogate person has no genetic ties to that baby, has no DNA at all. It's an egg from the mother, egg from the sperm from the father, put in her. She's literally just a carrier. Sometimes it gets a little more tricky. Sometimes if the mom's eggs don't work, as well as her uterus, they can get a donor egg. So an egg from a bank and sperm from the dad, and then put that in a surrogate. Sometimes it can be an egg from the surrogate herself and the sperm from the dad. There. Let's get even deeper. Sometimes it could be donor sperm. So you could have a situation where it's an egg from the mother, donor sperm in the surrogate. It could be an egg from the surrogate, donor sperm in the surrogate. Or it could be donor egg, donor sperm in the surrogate. As you can tell, this all gets very tricky, but it's possible, and there have been successful pregnancies through this. It really takes a lot of communication between partners to determine how they want to go about this, but it is possible. So it's not impossible, it's possible. The biggest thing that I want you to take away from that is you need to research the legal ramifications of this, so that you don't go through the emotional roller coaster of a pregnancy that is outside of you, outside of your control for the most part, and then now have to deal with, ups and downs of the legal system afterwards. Okay, so I'll try and leave out as much of the technical terms, because even just describing the process itself can get a little tricky. This is one way that you can try to have a child if you still have some genetic material, or you still can get it from an area where you can control what you can control, in terms of eliminating certain disease processes from the sperm, from the egg, and all of that. Because yes, in these processes, a lot of times you can pick everything down to the eye color of the child. Again, this is an area that makes people comfortable and an area that makes people uncomfortable. But making sure that you're dealing with a physician that is well trained, both in all the legal ramifications that come along with the process that you do choose, and in the process itself, and has excellent success rates, and it's not doing crazy things like putting 20 embryos in you, then you should be in good hands. Sometimes, unfortunately, this route is not available to everybody either, or some people are uncomfortable with having a child that possibly has no genetic material to them, and they don't want to risk going through that whole process and not being able to bond with this child. Some people will choose other options like adoption. There are a lot of children out there who need good homes. So many of them. Statistically, children from minority communities are not adopted at the same rate as Caucasian children, especially here in the United States. For places in Ghana, I mean, we've got systems set in place where extended family sometimes helps, but even so, we have orphanages still. So adoption is a very honorable option for that a lot of people sometimes hesitate to consider, and I really feel like this is an area that, especially if you have somebody that really wants a child of their own, you can impart so much love to a child that otherwise would not have it through this method. So probably an area that we should probably look at more. Every child, no child asks to be born, right? No child asks to be born. They come into this world, and unfortunately they are not equipped because they don't have a foundation to help them. And so if you find yourself in a position to assist in this route and fulfill what you want to do as a parent and possibly offer some love to another child, I think that just gives me, okay, I won't get emotional. Okay. But adoption is a route to go. Same thing. Make sure you're doing it legally. Make sure that this is not, there's a lot of trafficking that is going on with children all over the world. I've been involved in seminars where, we've had people talk about their experience with being trafficked, and it's quite horrific. So make sure that these are not children that are being trafficked, or that you can recognize those, when you're going through this process as well. There was a story I read recently that was quite impressive about a young man who, he's probably in his late 30s or 40s now, and he knew he had been adopted, but long story short, come to find out that he was actually still considered a missing child from Hawaii. And here he was in his 40s. His parents who adopted him had no idea about this. He just happened to run across a story in a paper about children who had been illegally adopted and whatnot. And he put his information in there, and there was a computer generated image of what he should look like, because this had happened about 30 years ago, and there he was. It was him. I think you can go on Google and probably find that story. But yeah, let's just make sure that we're researching, if we can, to find out the background of the facility first of all, that you're going to do your adoption through, and have a lawyer go over the papers and things with you to make sure that everything is in order. You're not stealing a child away from a family that actually does love this child. But also make sure that you're doing this for the right reasons. There have been stories of people who adopt children as well and end up returning them. They're not goods, they're not commodities, they are human beings. So go into this with an open heart, and go into it for the long haul, because this is a commitment. Okay, I'll get off my soapbox now. All right, so there's that option. There's also another option of fostering a child. So fostering would be a system by which you go through a series of classes, you go through a series of workshops to equip you to deal with children from many different backgrounds. That way you can be a temporary parent to these children. So there are different kinds of fostering. There's fostering where you just provide temporary care for children who are either separated from their families for health reasons, for safety reasons, or until a family member can get paperwork completed to actually take over custody of them. And so you just take care of them during that temporary period of time, and then return them to whoever they permanently place them with, be it a family member or somebody else who adopts them. And there are systems where you can foster to adopt. So you foster the child as a temporary thing, but you also start the paperwork where you also adopt them. A lot of times, and I won't say all the time, but a lot of times these are sometimes children who are coming from environments that are not the healthiest, either because of drugs or chronic illnesses, HIV, hepatitis, all of that. So you have to, the kind of people that go into this really always inspire me, because this is not your biological child, but you have to be willing to be a compassionate person to care for this child. And they could be, you could get a phone call about an infant is being born, in 2 hours, and will need a place, and are you going to be ready to take that child in? Two, it could be toddlers or tweenagers or teenagers. You could get a phone call about taking in a whole family of children, so two siblings, or 3, 4, 5 of them. And you don't have to. I think the agencies usually always want to try and place children together, but sometimes they can't. Again, this takes really special people to do this. So search your heart, see if that's something that you want to do. The bottom line to this lecture is the only way to have a child is not through sperm, egg, meat inside person, and that's it. Because there are a lot of other ways. But some of the other, and even with that traditional way, you still have to make sure that you want to be a parent, right? And not everybody that wants to be, and that's completely fine. The worst thing would be to have a child when you really are doing it for other people, because parenting is very special, and parenting takes a lot, and you have to want to do it so that you can give these children the best chance at life. So yes, there's the traditional method. There are a lot of non-traditional methods. They get very technical sometimes. They get very tricky. They get legal. There's a lot of emotion in it. There's a lot of resilience needed to go through it, but it is possible. So, and nobody needs to know how or why or, your child came to be. That's really none of anybody's business. It's up to you if you want to share the story of how you got your child. But you don't have to. So, I deal with a lot of people who have family pressures. I had a patient who said to me that in their family they had to have at least 5 children. If not, the husband was allowed to go and have more children to make up the 5 with somebody else. Okay, so there's a lot of different backgrounds and cultures and whatnot that go into people wanting to be parents. Just examine yourself, make sure it's something that you're comfortable with, and know that there's a lot of options out there. And usually your friendly OBGYN can point you in the right direction. Okay, I'm going to go ahead and take some questions now and see what we have here. Oh, Fisher's watching, yay. And I would like to shout out one person in particular today. Shout out. I'm aging myself, but I always say hi to Kwame Cheyamwa. This is a friend of mine from elementary school, and I always commend the men who come on here because, I know a lot of women have a lot of questions, but I think it's so special to have the men on here because it tells me that they really care about the women in their lives, their moms, their sisters, their wives, their daughters, and it's very touching to me. So, hi Kwame, and thanks for being here again. Hi Fisher. Let's see. Hi Angie. Okay. I'm looking for questions. See a lot of likes and waves. I'm waving right back at you, and I will come back through and respond to anything that I miss on here. Hi. Yes, some women need this. Yes. Hi, cousin. Hello. Hello, all of my medical moguls on here. Thank you so much. What herbs do you suggest are used to get pregnant? Okay, that's one question. I hear some people are not compatible and hence can't have babies. Maternal aunt okay, so that's another question. Adoption is unfortunately a complicated process. So glad you're bringing this up. Okay. All right. Is adoption fostering only for couples? Okay. And then some laughs. STDs you can get from conceiving. Okay, so you're right. Adoption is a very complicated process, which is why I truly encourage you to research all the research the agency that you're looking at, and make sure that they have some success with the process, because you would hate to start the process with an agency that has not gone through this before, and it's already an emotional decision to make the decision to go through fostering or adoption, and then get caught up in it and not have any success as a result. Success being you being able to safely have that child. So I agree with that. Herbs that you can use to help get pregnant. That would probably go back to my lecture on fertility in the mature years. I am an osteopathic physician. I'm not a naturopath, so I don't have an extensive list of herbs or anything, but it depends on the reason why you're not able to have a child. If the reason why you're not able to have a child is because your tubes are blocked, I don't think there are any herbs that can unblock your tubes. If the reason is a male factor, that's the sperm, then the woman can take as many herbs as possible. You're not going to be able to have a child. If it is an ovulation thing, if it is a low estrogen, plants, any herbs that have phytoestrogens, that's plant estrogens, can help boost that. If it is because of a blood clotting disorder, then there are some plants that have factors that can thin your blood. But you can also do something as simple as take a baby aspirin. And sometimes you have to do more. You have to take heparin, things like that. But there are some herbs that have blood thinning properties to them. If it is because there's a huge fibroid that's blocking your uterus, herbs are not going to help. So there are herbs you can take to help depending on the reason why you're not able to have a child, but it goes back down to the root cause of that. And I think I talked about that there. Anything with soy, anything with phytoestrogens there. Okay. STDs you can get from conceiving. This goes back to probably the people that are doing the insemination by themselves without the assistance of an OBGYN or an infertility specialist. Every single OBGYN that's accredited, at least in the United States, and I'm pretty sure in Ghana, UK, everywhere in the world, should usually run an STD panel on the female at the very first OB visit. The good thing about STDs, if I could say that, is a lot of them are treatable. So gonorrhea, chlamydia, trichomonas, those are all things that you can treat with anything from a 1-day to a 7-day course of antibiotics. Things like your HIV may need a little more extensive treatment, but that's actually been quite well managed, to where some people have absolutely no viral count by the time of delivery. And I even able to have successful vaginal deliveries by the end, because there are treatments for that. Let's see, there's hepatitis B, hepatitis C. So there's a series of syphilis. Syphilis is another big one. So in syphilis, that might be a little tricky. That's one you want to catch early on, because the baby can have some physical defects from that. Let's see. I read one before and now I've forgotten what it was. This old age business. Okay. Thanks for inviting people to this. I appreciate. What did I read before? Okay. I should probably just go back to doing one question, one answer, rather than trying to read them all and do them all at the same time. If I used to get pregnant, I did that one. Oh, the compatibility thing. Yes. So I'm trying to think of a best way of addressing this. So sometimes it goes back to the cervical mucus. Sometimes the mucus won't let the semen go through. Sometimes the pH in a woman's body. So our pH makes us either acidic or alkaline, right? Go back to chemistry days. And sometimes that might need to be worked on a little bit. There are things they can do to, you may need to bypass the cervical mucus and do things like the insemination to get the sperm past the cervix so that it's not being blocked by the cervical mucus. You may have to use IVF to actually get the egg and the sperm to form into a zygote embryo, and then implant back in. So there are ways to go about bypassing that as well. Going back to STDs, let me just mention this as well. There is something else called sperm washing, where if the man has some kind of genetic disease or something that he wants to not pass on to his child, they actually can wash the sperm, basically clear the sperm of that particular factor, and then inseminate that as well. When it goes back to the IVF, I think I mentioned before that you have some control sometimes over picking things like the eye color and all of that of the child. But the area that I think this is most impactful is when either one of the parents has particular genetic conditions that either shorten the lifespan or chronically affect a person's lifespan. So things like cystic fibrosis can be extracted out. So they have testing that they do for this. So, okay, I think that's it. Thank you, AP. Thank you, Dr. Sutton. I love having you here. Okay. Some STDs can... crazy. Is it true that some STDs can prevent some ladies from conceiving? Yes. Okay, I'll use this as the last question. So, yes, some STDs can prevent you from conceiving. And the first ones I mentioned were gonorrhea, chlamydia. They can cause, if they go untreated, they can cause scarring in the tubes in the uterus. There's a condition called pelvic inflammatory disease, PID. So if you get gonorrhea, chlamydia, and you don't get it treated soon enough, it can cause scarring, and specifically scarring in the fallopian tubes, which is the meeting spot. That's the lover's lane for those of us that went to boarding school. That's the lover's lane, that's the meeting spot, that's the gating site. And so if you have a blockage there, egg and sperm cannot meet there, and that can cause you to not be able to get pregnant. So I always counsel, especially the younger ladies that I see who come in with that. You don't want to get that recurrently, so you don't want to have multiple episodes of that. This is why it's important to practice safe sex when you're not ready to have a child, just to prevent being able to run into these conditions. So thank you again, everyone, for being here on another Saturday. I know there's a lot of things you could rather be doing with your time, so I really, truly appreciate the time that you spent with me. And I will look forward to, I think from some of the feedback I got before, next week should be another GYN topic. As of right now, I'm leaning towards doing something on birth control. If you have questions or something else you want me to talk about, don't hesitate to post those, and I'll look back on those, and I'll send out a reminder as usual by Thursday next week of this week on what the topic will be. But it should be a GYN topic next. Okay. All right. Thank you. Once again, I'm Dr. Vanga, your board certified osteopathic OBGYN, coming to you to help demystify these myths about our bodies, to help us make more intentional and make healthcare decisions with confidence for ourselves and for the women in our lives. So thank you, and have a wonderful, wonderful weekend. Take care.